Hey guys, Dr. Braddock. I'm coming to you from my living room actually, and I want to show you something on my television that I caught last night. I've actually seen this commercial a couple times. Every time I'm just left scratching my head. And last night we were watching the television and this commercial came on, so I hopped up and I recorded it. And before I headed to work this morning, I thought I'd pull out my video camera and kind of talk to you a little bit about something that I think is actually pretty shocking. So what I want to do is show you the commercial, and then I'm going to talk to you about a couple of things in the commercial and see what you think. And then afterwards I'll talk to you kind of about what my total opinion of this is and what you need to know. So check this out. This is for an antidepressant called Seroquel.
It follows you wherever you go. It's a cloud of depression. And although you've been on an antidepressant for at least 6 weeks, you're frustrated that your depressive symptoms are still with you. Seroquel XR, when added to an antidepressant, is approved for the treatment of major depressive disorder. For many, taking Seroquel XR with an antidepressant was proven more effective for treating unresolved symptoms of depression than an antidepressant alone.
Okay, I'm going to go ahead and pause it here because, I don't know, maybe this is a 90-second spot. And so far what you've heard is that Seroquel, this basically super antidepressant, if a regular antidepressant is not enough, you can add this on top of that, and then a lot of times you will see symptoms. So, or you'll see relief supposedly in your actual symptom of depression. Now the rest of the commercial is talking to you about some of the things that you might consider that could happen as possible side effects as taking this drug. So pay attention. We've watched maybe 15 seconds of a commercial about why you should take Seroquel, okay, because of the cloud above you. And now I'm going to show you the actual side effects of Seroquel.
Call your doctor if you have unusual changes in mood, behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Seroquel XR have an increased risk of death. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Seroquel XR and medicines like it, and in extreme cases can lead to coma or death. Your doctor should check for cataracts. Other risks include decreases in white blood cells, which can be fatal, seizures, increased cholesterol, weight gain, dizziness on standing, drowsiness, impaired judgment, and trouble swallowing. Use caution before driving or operating machinery. For more help putting distance between you and your depression, ask your doctor about adding Seroquel XR. Visit SeroquelXR.com for a free trial offer. If you can't afford your medication.
All right, guys, basically I think you got the gist here. A couple things to think about, okay? Because first thing I want you to understand is I am not refuting that depression is a real thing and that some people deal with depression that is extremely severe. But what I do want you to think about is the fact that we live in the United States. Okay, the United States makes up about 5% of the world's population, yet we take 80% of the world's drugs. All right, we have immigrants that are risking life and limb, okay? They're literally risking their lives to get into our country, to take any job that we'll give them so they can live the American dream, okay? So they have the right to pursue their passion, their dreams, and to do that without persecution like maybe you have in some other countries. So think about that. We've got immigrants risking life and limb to get here. Even though America does have its fair share of problems, especially right now, I think everyone watching this video would agree that we're extremely fortunate and blessed to live in this country. Yet, of the top 10 selling medications that we have, 7 out of 10 of those are major antidepressants. And what you have to understand is antidepressants are probably some of the most dangerous in the medicine cabinet in terms of the side effects. I think that you guys will acknowledge about how many times they mention fatality, death, possible death, seizures, so on and so forth, permanent damages that can happen to people. And in recent university studies, they found that exercise, moderate regular exercise, outperforms the top antidepressants every single time in studies. Okay, so let me ask you this. If you knew that just exercising 3 to 4 times a week, moderate exercise, really has no side effects other than maybe some weight loss, maybe some some increased energy. If you knew that could outperform something like Seroquel or any of the other antidepressants, and I'm not just picking on this one because they're basically all the commercials that you watch every night, if you'll pay attention, 90-second commercial, maybe 15-second spill on why you should take it. The rest of the time they have to take, giving you all the warnings that they're required to give you that could result in you actually taking that medication. So just think about that. Think about what we truly are blessed, what sort of good news we have, and then how many depressed people we have, how many of us are taking medications. Now, the other thing about it is you have to understand that there may be a drug like this that's necessary in a certain situation, but in the United States and New Zealand are only two countries you'll sit down to have dinner, like I did last night, watch television, and get marketed to by the pharmaceutical industry. Europe, that doesn't happen. South America, that doesn't happen. The United States and New Zealand, the only two countries. They don't let Joe Camel talk to you anymore on television. Am I right? Because that's dangerous for Joe Camel to talk to you or talk to your children. But they tell you if you feel down and out, if you have a cloud following you around, maybe you want to do this. And if you're not even sure, call us. We'll give you a free sample of this potentially dangerous medication that you, as a healthcare professional, aren't even necessarily sure that you need. Okay, so now we have consumers going to doctors and requesting, I need Seroquel, I need the purple pill, I need whatever that maybe we were marketed to on the television. And some of our doctors, great medical doctors, are actually having their arms twisted to provide medications upon patient's request and not upon that doctor's determination of whether that particular patient needs that particular medication or not. Things to think about, things that when I sit around, I scratch my head and I think, wow, I mean, if you had a car and you said this is the most amazing car ever, however, sometimes the right wheel can fall off, okay? Sometimes the brakes may not work. This car may result in death. Potentially this car could swerve to the right off of a cliff anytime you're driving along a cliff. The airbags may deploy without any warning. Seatbelts are not necessarily proven to stay stabilized. You would have a really hard time selling that car, yet for medications like this, people are running in droves to their doctor and they're begging for these sort of medications. Health is not in a pill. Health is inside. It's an inborn, God-given thing. You just need to unlock the potential to be healthy, and that's what we do in our office. Thanks for watching this video. I welcome your comments. Good luck. God bless.